Hello, Austin County. Today, we're excited to have two very special ladies in the studio. We have Michelle Wright, who is a county extension agent for the Texas A&M AgriLife, and Rosalinda Marez, a program coordinator for the Reaching Well program. Thank you, ladies, for joining us. And you guys have a lot of information, so I'm just going to turn it right over to you. I guess we'll start with Michelle. We'll let you tell, how did you and Rosalinda get in contact with each other?
Well, Rosalinda was in her former position of child safety technician. And so that's kind of how the relationship started. But this opportunity came to us some months ago related to trying to build healthier communities in Texas. So we're just thankful and fortunate to be a part of this initiative for people in this area.
So, Rosalinda, you worked with Texas AgriLife prior to assuming the role you're in now?
Yes, I've been with AgriLife for 10 years now, and so working in rural public health, injury prevention, things specifically with the rural public health, and helping people with education. When I was in my previous position as a car seating technician, and then now as a program coordinator, working in Austin County.
And that rural education is so important. It is, because people don't realize how many things are out there, programs and churches and, government things that people can get. They just have to know where to look. And so that's what you guys are going to do for us. So tell me about this initiative that I understand it's called Reaching Well. What does that mean What does that mean?
Okay. So the Reaching Well program, it's actually funded by the CDC. And the REACH acronym, what it stands for is Racial and Ethnic Approaches to Community Health. And this grant, we're working with the CDC and, in our rural county. So I myself am servicing Austin, Liberty, Matagorda, and Waller County. And what the goal of the grant is to create partnerships, build relationships with the community, local organizations, faith-based organizations, the schools, local community organizations, and community leaders to help bring some education as far as health and wellness goes. So chronic disease education, making healthier lifestyle choices as far as food goes, and helping with resource awareness. So providing that, serving as a tool to educate the community of resources that are available in their community, and what they can have access to. Because we know that a lot of times in these rural areas, there isn't access to healthcare, whether it be because of transportation or just having the healthcare organizations in the area, as well as access to fresh fruit and vegetables that can be an issue in rural areas. And so being able to bridge that gap and bring these resources to
sometimes people, they are afraid. They might feel, well, I'm sick but I'm afraid because I don't want to go to the doctor. My friend went and they didn't come home, or I don't know which doctor to go to, or, even just the fact that there's a plethora of doctors out there. Who's the best? How can I get to? Will they accept my, Medicaid, Medicare, CHIP, all those things? Is that what y'all are doing, is trying to help connect people that way?
That can possibly be one of the ways that we can work, and we can help. But primarily is building partnerships. So for example, with faith-based organizations or local churches, establishing a relationship with them, getting them access to, educational programming as far as health and wellness, lifestyle choices, food choices, healthy living, and then also giving them the tools. So for example, in one of my counties that I've been working in, what we've been able to do is have a yearly family health expo. And so, for example, what that family health expo entails is, we've had the there was a blood drive. So the blood drive came out in their mobile unit. And then also there was a vision screening available for the communities. They had health screenings as like blood pressure readings, glucose monitoring, waist circumference, and then giving them that education as far as what can we do to make healthy choices. We also had a gardening demo where they had small educational sessions on how to grow tomatoes or whatever the fruit or vegetable that is in season around the time of the expo. Things like that. And so wanting to make it sustainable to where it's something that we could hold every year, and the community eventually knows that they're going to have access to these resources yearly. So
it'd be kind of like the fair. It'd be like, down at St. Luke's Church, every November they're going to have the family expo, and there'll be sisters and screeners and just educational materials. And it's for all ages. I mean, are you focusing on one group, like elderly, children, teens?
Yeah, I would say all, but with our different compartments or components, I guess I could say, with the local churches, it would be more so for the adults. And so right now I'm a little vague with it because what we're doing initially is doing assessments as far as what's available in the community already, but then also asking the community members their opinion as far as what they feel that the community needs, what it's lacking, and then what they want to see in their community that could help them make better decisions when it comes to their health and wellness.
So I would say, so you're not coming in to roll over what's already there?
No, we're not. That's not what the Reaching Will initiative is all about. It's kind of like that proverb, and I know many of us have heard that proverb. You give a man a fish, he will eat one day. If you teach him, he will eat for a lifetime. And this is what this program is about, is teaching people how to live healthier lives. As healthier people, they live longer. But that's going to be through the form of education. Education will be the resource that will be brought to the people in order for them to be able to do that. But it's not here to replace anything that's in this county, the systems that we have in place, but it's to accentuate the resources that we have in this county, which is what the purpose is all about.
I was going to say, and that I think goes back to the whole, people are not afraid to go to a church to learn some things, but they might be afraid to step in the doctor's office.
Period. A lot of people have white coat syndrome. A lot of people are definitely afraid of doctors.
I am. My blood pressure, shoots up every time I step through the, doctor's office, because you're old. It's terrible from the time you're little. You're afraid of a doctor or nurse or whatever, and you shouldn't be. Even dentist, and you shouldn't be. And that, I think this might be a good thing, because people will understand. Hey, we're here to help you. It's not pointing a finger like somebody who might make us a little bit on the fluffy side. I'm not going to get a finger pointing and a head wag. You're going to say, "Now look, you have, you're a little fluffy. Here are some ways that you can be not quite so fluffy." And that sounds like exactly what you're looking at doing.
That's what it's about. Chronic disease prevention is the bottom line. That's the whole goal, is to help to prevent some of those chronic disease issues that oftentimes communities are being faced with. So if we can do that, that's the big game. That is the main thing, is to help people to ward those things off as long as possible by doing things that are going to help them live healthier and fuller lives.
So I was going to say, even things like, I had a friend who was working on, trying to slim down, and he didn't realize, funny enough, that drinking sweet tea. He kept saying, I'm not losing. He says, I'm not eating so much. And once we sat down and kind of discussed food, he was saying, so I'm doing this. And he says, and I drink tea. I said, does it have sugar in it? He said, it does. He said, that's all I drink all day, sweet tea. And when he cut out the sweet tea, lo and behold. But it's simple things, because we're Southern. What do we drink? Sweet tea. And so even things where people don't realize, one apple is good, 12 is not. They don't realize quantity and things like that. So that can be, some of the things obviously that y'all are trying to do.
Because oftentimes people don't realize that every teaspoon of sugar is 4 calories. Yeah. And it adds up, especially if you're doing that all day long.
Right.
So that's where it's coming from.
Right. And that's the thing is it's amazing.
And those are the things that this program and this initiative is all about trying to teach.
So it's not only talking about health, but it's talking about physical activity.
Absolutely.
Yes. So getting people to be more active, and what they're able to do. So we want to, from these assessments that we'll be doing with, the church or with the schools or early childhood centers, is doing an assessment about what is it that we have already and where can we improve, make those changes that are sustainable to where we can continue to do them. And even with physical activity, so if we have the elderly population that can only do so much, well, maybe we can add some more housework that can count as physical activity, or
parking at the end of if you're going shopping, instead of taking that, fighting people for that parking spot that's in the front, park in the back.
Get some extra steps in.
That simple as that.
And I'm certain that, you can talk about partnering with the churches. I'm sure there's a sports group or something that could come and even do a little activity with your elderly. They don't have to do jumping jacks or whatever, but I've seen interesting things where they even do like chair aerobics.
Absolutely.
Where you sit and and it just was fascinating.
Retention ends. That's very common.
And things that, because people, I was to say, even like I'm the kind, when I walk, I like having a friend. And so I know they say if you buddy up, maybe you could find walking buddies and things like that through this.
And that's what the assessments would be for, is to, look at what the responses are looking like, and then be able to regroup and come up with a program that we can do with the faith-based organizations. And then as far as the daycares, the local daycares, we have other components where they can do an assessment and then check off some boxes on what they are already doing and how they can improve, even if it's a slight change. And that's where I come in. So I'll be the assistant for the community with these assessments under the Reaching Well program.
One of those things I'm going to turn our next one. It's talking about things to do with the churches, and that. So basically, if you want to start this, you can call up and say, "Hey, Rosalinda, I go to St. whatever church.
Yes,
I'd like to have this. What are some things that I can do to get my people going?"
Yeah, that'd be, open to local churches, and they just reach out to me. We can schedule a meeting in person, and I'll come out here and we'll discuss what the physical activity looks like already. Health and wellness. Do they have anything going on already? Because some churches, they already have like a community health committee, or they put on certain events or programming. And then do an assessment. So some of the things that can come out of it is that you have the coffee with clergy, and that's where we'll sit and talk with the clergy and talk health and wellness related to their religion and all of that, where that plays in or where it comes in. And then the Well Church and Community Conference, that one would be specific to the church, where we could have, whether it's quarterly, biannually, or once a year, where we can have these health screenings available, or health and wellness breakout sessions where we can have, courses or educational sessions on whatever the topic may be. And then access to any potential partnerships or organizations that provide these health and wellness resources. Even with the food banks, trying to bridge that gap in the community, and having access to fresh fruit and vegetables. So, if there's already a place or places that already have these produce drop-off locations, and some people aren't able to make them depending on the time and day that they're being offered, well then, maybe we can do a different day and time that people are actually available to come and get access to that. It just depends.
Absolutely. Yeah, they could make the deliveries, because I know a lot of the high schools and week creeks, they have, they need them to do service hours. And what would be better than, taking those boxes to those that can't get out? Because you keep talking about different things, but there's a lot of people that they don't realize they're shut-ins, and they don't have anybody. And so they may be in desperate need, but they're ashamed to ask, or don't know to ask, or don't know who to ask. And so that's the thing, is this would be, this is the kind of thing that hopefully, we're getting out there that people will see. And even if you can't personally do it, if you know somebody, that's looking for something to do, as far as being of service to others, that would be a wonderful thing to do.
And Shelley, the thing about that as well is when the community is actually empowered, that creates that sustainability piece. Because when people begin to feel ownership,
Yes,
they believe in it, they trust it, it'll work. And that's what keeps it to continue. That's that continuation piece that's important for that component.
like you said, if you drop in and drop all this information and leave, and nobody ever sees you again,
Yeah, absolutely. I won't last.
it withers on the vine. And so that's the thing. It's, you need to get people invested in it. Ice holders.
And it's strong community leaders that, just have a passion for their community, that want to help out in any way they can. That's what we're looking for. Because like you said, there have been times that people come in and they're not there for long. And then it's what happened. But that's not what we want to do. That's why we want to give the community, the churches, the schools, or organizations, that power for them to establish what it is that they need in their community, and bridge that gap with, health and wellness and food. And
you talk about the daycares and things like that. I'm a career school teacher, I just retired. And one of the things that I noticed was children talk, and you will hear them say, it's snack time. Well, we don't have a snack at home. And I've even had, it was the family was, anyway, it was a very sad situation. Like the little one, she brought a snack, but it had been opened and it had roaches in it. And, this is just, of course, my heartbroken. I was like, baby, what? I have something better. Why don't you let me give you something else? But that, and she was like, well, this is all we have, and it just, and I taught in a rural community. And that was the thing, is that there were so many of the children, would come to school hungry. They would eat everything on their plate and tell their parents, are you going to eat that? Or are you going to eat that? And it was just, it's heartbreaking. It is. It's heartbreaking. And so this, I guess, would be very personal to me, the fact that you see these children through no fault of their own, and even elderly through no fault of their own, have this food insecurity and, different things.
Yeah. And so, two of our components that we have, so the Texas Healthy Building Blocks and the Go NAPSACC, these programs, these are tools that are available to local daycare centers or early childhood. It's free, yes. And they can reach out to me, and I'll be their technical assistant, their consultant for, to go through this program. We'll walk them through it. And then, they'll be able to assess what they already have going on in there with, as far as like serving food. And then we can help them check off some more boxes on how they can improve. So
to make sure the things that they're serving, like for snack, are not serving cookies and juice. They're maybe serving fruit and peanut butter and some real vegetables.
Exactly. Yeah. And
celery sticks, absolutely.
And then also other components like oral health, physical activity, outdoor playing, and then screen time. So
screen time, that's that age. Oh, that's brutal. That's built-in children.
Yeah, that's a baby.
Oh, where do you go? That was one of the things that I noticed, is that you do these children, they always really stick. We've got recess, and they're like, guys, You need some fresh air and sunshine. Run around. They don't know how to play.
Well, I remember when we were young, we didn't want to go inside. Didn't go inside. It was a pleasure to be outside. And so the light in the middle of the street turned on you. It was time to go home.
But we also didn't have iPads. We didn't have iPhones. And that was a big part of it. People don't realize that adults and children, adults need to limit that screen time because you don't realize how much it takes up your life. You will. All of a sudden, you're like, it's that on.
You could just mindlessly scroll and then an hour has gone by.
Right? Yes. And that's the thing. And you think, I missed all that beautiful sunshine outside that I could, have gone out and walked. And can I add this, Shelley? A lot of times the best conversation used to happen around the dinner table. Yes. And that's when people got the opportunity, families got the opportunity to catch up, sit and visit. But then even at the dinner table, it's taking that away because of the time. Everybody has their phone at the table. So you don't have that opportunity, which that time at the table, mealtime, is precious. And that's another thing that through education to teach families how to get back to the dinner table, how to create that conversation, how to get those check-ins with each other. How was your day? How were things at school? And it's all around meals. Meals are oftentimes the thing that brings people together. So things that are going to bring us back to the table, nutritious meals, that's another way that this initiative can really bring closeness to families and to just the people in the community. As I say, even in the Bible, they talk about, when they sat around the table. That's it. The Last Supper. You have all these places that great things happen around food. And it's even better when the food is good for us. Yeah. And the thing about it is if you have, say you have somebody who grows, like my mother, she grows fruits and vegetables. More vegetables and fruits. But anyway, and a lot of times she'll have excess. Can you put people in contact with other people? Like if mother would have an excess of, say, tomatoes. Onto the pantries. Get those items to the food pantry. And we have several around the county. So that's the kind of thing. Because I know one of the things you said was fresh fruits and vegetables. Because some years you have a bumper crop and other years you don't. But that's the thing is, your family can only eat so many tomatoes before you're tomatoed out. And so that's the thing is that being able to do it that way.
And then, when you do get, fresh access to fresh fruit and vegetables, or you get a box from the food bank, it's knowing what to make with what you've received, just depending on what the assessments say from the churches or, the community is, okay, well, is that a potential program that we could implement? Is recipes to make, healthy recipes to make with the items you've received or with the fresh fruit and vegetables you've received. Because a lot of the times, you look at it and you're like, I don't know what to make with this or what am I going to do with this? But sometimes you just need that extra push, and even with AgriLife, we have programming.
We can do that.
Exactly. Yeah, we can do that. Of what to make. And then we could even, if that's what we want to do, we can have a class where we put together something and everyone gets to try it to see how delicious it can be.
I'm just saying, you don't realize that some things are so versatile, like eggplant. You can make eggplant parmesan, you can, roast it, you can make soups and out of it, and it just... And planning a healthy meal on the budget. No, budget. People how to do that, how to eat what they need to eat that is healthy, but it's budget friendly. I was going to say, because unfortunately, the way our food system is, they're not throwing shade at anybody, but just the way it is. You can get a bag of Cheetos, off-brand Cheetos at the dollar store, or you can get one apple. And so we are fighting the industry because they have made it to where your fresh fruits and vegetables are so much more expensive than your junk food. And so that's, like you said, and people want to maximize, if I spend this money on this fresh food, but I don't know how to cook it or to make it appealing to my family. You can cook it, but will the kids eat it? And so that too is, like you said, you would need some guidance because.
Yeah. And that brings up another point with, when we're talking about local is we're also wanting to talk to local farmers, to do an assessment with them, to ask questions about what their thoughts are on access to fresh fruit and vegetables in their community. So that's another one of our components, is talking to local farmers to sit down and ask what their thoughts are.
And even what they grow.
Yeah. What
Because
they
I know corn and cotton is big around here, but people grow other things. And so that would be too, getting a survey of, what do you grow, and what would you have an excess of?
Yeah, and would you be willing to either donate it or sell it at a certain cost, to where people can come out and purchase it. So just trying to, still in that assessment phase, with our REACH program, is still figuring it out, because I'm new to the county, and so the community members, they're the ones that know their county, their community best, and so they would be able to tell us, like, okay, this is what we're lacking, this is what we need, and as opposed to other data that is already out there.
So pretty much, it's anybody who would be in a position to make decisions for a group, church, secular, like the Kiwanis or whoever. They said, we see in our people that come, they need this. They could reach out to AgriLife, either Michelle or Rosalinda, and say, hey, I think that, my community here who benefit from X, Y, or Z. Then it sounds like you guys are going to pretty much bend over backwards to make sure that happens.
Absolutely. Forging those partnerships. Building those partnerships, establishing new partnerships. That's what it's all about.
And if it's something that that I'm not focusing on, I can at least tell them, let me find you the right resource or the right person that you need to talk to, so that they can help and follow up and make sure that they were able to reach out to the person that they need to. And so, yes, our Reaching Well is focusing on health and wellness, whole body wellness, and then also giving the community access to education on immunizations. That's also one of our components, is just providing that education to the community, and giving them that resource of knowing where they can receive immunizations if that's something that they would like, and that just knowing where it's at. So if someone asks them, where can I get this immunization, then they at least know.
Mm-hmm. And we work closely with DSHS here. So,
Which is what?
The Department of State Health Services.
Just to make
Get talking happening.
We do a lot, but you're so right.
I was just saying, you were talking about doing things. I know that you guys are going to have an expo. Tell me about that. That's the case.
Yes. And so with this initiative, this REACH grant being fairly new, we're still in the assessment phase. We're actually having something like a kickoff, or maybe like a pilot, to see what the turnout looks like if the community shows up, if we have these resources available to them. And so we've actually been lucky enough that Memorial Hermann is wanting to come out and provide education and give educational resources to the communities. So they're, on this Saturday, November 16th, at the Bellville Methodist Church Gym, and they've been great to let us use their facilities for this. We'll have a diabetic dietitian that'll be there to ask questions, where the community can come out and ask questions. They'll have a roundtable with the cardiologist, so asking questions related to that, and other local tips and resources available for the Austin County community. And we're looking too, if anyone listening in, if there's a organization here in town that wants to be a part of it, please reach out. We would love to have them there, have access to immunization education.
I was like, keep going, but this is the information if you want to reach out and, offer your services. And the thing is I'm certain you guys have the screening process. I couldn't just go up there and say, hi, I'm Shelley, I'm a doctor. You're going to have some absolute credentials, obviously. But the thing is that you contact one of these ladies and, offer some services. I'm sorry, I'm pitying you guys.
Yeah. And please come out because, this is what we're seeing what it's going to look like. Because what we want to do eventually in the spring, summer time is do it again. Maybe a little bit bigger, more refined as to what the community says that they would like to see as far as health and wellness goes. But just to get a feel of what we can provide, we would like for the community to come out on that Saturday, November 16th from 10 to 1. We know we'll have, there's going to be blood pressure readings, glucose monitoring, some other local screenings, and health and educational resources. And then, ideally we would like to be able to provide immunizations, but we haven't gotten there yet as far as finding that contact that would be willing to provide it for the community. But that's something that could happen come spring.
So I got any doctors, nurses? They're interested in helping.
Or if anybody thinks of something else that they could provide, like something different, come on. We're always looking for anything or any other health and wellness resources because a lot of it ties into your whole body health.
Basically, from the top of your head to the bottom of your feet, you're looking at having assessments for whatever you can. Eyes, ears, like you said, glucose, heart, blood pressure, things like that. And I mean, obviously, this is not a medical facility. This is just screening. So they could tell you, hey, your blood pressure is 5,000. You need to probably go see a doctor thing. I mean, that's just common there.
But we really need people to come out because this is going to be the one thing that's going to help springboard us into the next phase. So it's really important that people come out to the expo.
And then maybe next one we can have more resources like vision screenings or dental screenings. We just don't know. We're just kind of piloting to see what the turnout is going to look like. But please come out. Please reach out to me. If you just even want to talk or get more information about the program, my contact information is on the screen, and we can schedule something in person or virtually or just over the phone. So
that's the thing is you ladies are willing to go that extra mile for the community, and it really shows. I mean, you can tell by the passion in your faces that you're really serious.
Oh, I love it. And I love rural areas. I don't know, just near and dear to me.
I was say I just moved here to the rural area from the big city, and I'm loving it. I love where I live.
I love the people, just how sincere they are. Just small. It makes me want to work for them.
All right, ladies. Well, have we covered everything?
I think so.
All right, and this Rosalinda has a little something to tell us for you.
Yes, I wanted to just reiterate that our grant and the REACH programming has been made possible with funding from the CDC, the Centers for Disease Control and Prevention through the Reaching Well Church School and community projects with Texas A&M AgriLife Extension. So thank you all for your time.
Yes, thank you. And we'll have next time, Austin County.
Take care.
Bye-bye.